Hello there. My name is Dr. Fred. It is really great to meet you. This is your first time here at this practice, isn't it? I could always tell a new face and of course a new patient. So, are you enjoying your visit so far? I know that you were greeted well at reception. We have a little bit of a process here. We like the patient to feel like instead of they're at the doctor's and getting a routine checkup, which is what you are having today, we like them to feel like they've had a little bit of an experience, like a hotel sort of experience. So their job is to greet you as best they can. My job as a doctor is to look after you, make sure you feel incredibly comfortable and you're happy with everything that I'm doing, and you feel very content with being here in my office slash doctor's surgery, but we don't really call it that. We don't want you to feel like you're at the doctor's. This is just a very routine process to make you feel relaxed at the same time, knowing that I'm checking up on your health and everything is going to be as perfect as it can possibly be in regards to your health. It's good to get all these routine checkups. If you haven't had it in a while, then obviously over age we tend to get a little bit worse for wear, and things don't work as well as maybe as they did however many years ago when we were a little bit younger. So these routine checkups are great for you to come in, me to examine you, give you the once over, you know, and make sure that everything, which I assume it probably will be, that everything is looking and working fine with some simple routine type checkups, a little bit of examinations, but then again, we don't really want to call them examinations as well, because it's not an examination, it's simple procedures and tests to determine how your body is doing at this moment in time. Okay, like I said, my name is Dr. Fred, and I want to make sure that you have a great doctor's appointment today, and if you have any concerns or anything along those natures, worries, or anything you want to talk to me about, or just sit there and listen, of course, please, I encourage you to do that. But I assume that there's probably nothing that we need to look into at all today. Like I said, today is just a routine checkup where you come in and I just work around you with some various tests. You probably consider them to be, you know, a little bit easy and funny in places, but also some patients find it quite relaxing. You know, we have a little bit of a tendency in real life to just overdo it a little bit. Too many things, worry about a certain thing, something's on our mind, we give it too much thought. So this is kind of a little bit of a good break from that break in routine, going through some examinations and putting you first and of course your health. Okay, so are you sitting there comfortably? I know that's a little bit of a high chair there, but I want to make sure that you're sort of eye level with me and I can see you perfectly, which I can, and everything is well lit here for me. Okay, so you've been a new patient. You're just required to do one little formality, and that's taking your details down. Okay, so I'll just ask you what your address is, etc., etc. You just tell me, then I can jot it down in my computer, which I have here before updated on the system over there. Okay. Right, so your name and surname. Okay. And your surname. That's a really nice name that you got there. I'll be sure to remember that. Okay, so where is it that you live? Oh really? That's great area. I've heard some really great things about that place. No doubt because there are people like you there, which make it such a great place. Okay. And what number was that? Name? Oh. Very nice. Okay, and if I could just take the postcode. Brilliant, thank you. So, just getting you on the system. Do you have an email address which I can take? You can have your results or sort of follow-up, which are right up after your little visit today, and I can get that sent to you via post, or you can have it emailed to you. The option is yours, both. You can have them both if you want. Email? Okay, that's good. Of course, save the planet, etc. Okay, at brilliant. Excellent. And can I acquire a telephone number of you? Don't worry, I shan't be calling you about anything urgent. But should we need to contact you for any reason or update you, give you a little reminder that you should come in and get a checkup, then we can do so with just a nice friendly text. Okay. Brilliant, thank you. That's great, you've been very informative and clear and precise. Okay, so today we're going to be doing just a little checkup. Like I said, this checkup entails more of a sort of cranial nerve type examination. Have you had one of those before? Okay, so you're familiar with what it is? So, yeah, of course, so I get you to do some funny things, shine a torch in your eye, you know, just check everything in that area is all working fine. That's one of the fundamental checks that we do here. But before we get into that, I'd like you to tell me and talk to me if you have any concerns about anything, something that might be on your mind. This can be in regards to your mental welfare, or you might have a couple of symptoms like headache or something like that, or a little bit of pain somewhere. If you can tell me those things, I could write it down. These are the things which I will look out for the most, and maybe the cranial nerve examination or another little examination might sort of target that and put you at ease in terms of why you're getting those symptoms. Okay, so okay. Okay. So you've been getting a few headaches, right? And whereabouts is your headaches located? Sort of in the main forefront of your head there, okay? Yeah. And so they're not full on, so I wouldn't count that as being a migraine or something, but it's there and noticeable. Right. And when you get these headaches, do you feel them around that area? If I just apply a little bit of pressure there, is that sort of the spot that you feel it? Okay. Right, I'll just jot that down on the system. Okay. And what was your occupation? Really? Oh, how fascinating. And in your free time, do you spend a lot of time with screens? Okay. So, we'll do the cranial nerve examination, or parts of it anyway, just a couple of tests, and hopefully we can sort of come to the bottom of this. But what you've told me already so far is that the headaches which you're getting here seem to be sort of this mild feeling, and when you get headaches sort of around there, sometimes it can be to do with the straining of your eyes, and that invariably is with screens. You know, all that modern tech, iPhones, phones, tablets, televisions, computers, you know, you name it. Sometimes that can add added stress onto the eyes and focusing and things. So we can get you a few tips like that. But I mean, we have the opticians here as well. Maybe one time you can come in and get your eyes tested. Okay, well, that's something we can do. I mean, you're only just booked in for just a brief checkup today, but I'd like to reserve a little bit more extra time for you to come in and we can get your eyes fully checked. Okay? Test. So we'll get that booked in for you as well. Okay then. So now that you've told that, I'm just gonna come around you and we're gonna closely examine just random parts of your head. So the first thing I'm going to do is get my otoscope. You may be familiar with these. These are the instruments which doctors use to examine your ears, see if there's any infection, and I might be able to see something which could be the cause for your headaches or something along those lines. But it's a good start for me to see. Okay, so this for me literally is simple light on the end there. Okay, and that light I'm just going to shine in your ears and hopefully see in your ear canal and make sure everything is right there. So we'll begin with your left ear. Okay, so if you can just continue looking straight ahead for me, keep your head nice and still. Perfect. Okay, so I'm just looking in your ear canal here, and everything seems to be looking fine in your ear canal. That's not hurting there, is it? So I'm just pressing in just a little bit of pressure, but this shouldn't be uncomfortable. Okay. Okay. So what I've seen there is just a tiny build-up in earwax there. So if you just permit me, well, I can actually get two here. So no cause for concern here. But this is just to remove that little bit of earwax there for you. If you'd like me to do that, of course, you don't have to. Okay. So it's round about here. Okay, so can you feel that? Right. It's there. It's just a little bit. Sometimes we get a little bit of earwax. It builds up over time. Perhaps we're in a lot of headphones or not cleaning around the ears properly, and it just builds up a tiny amount. So I'll just extract that there, so it's not in your ear and it won't cause you any discomfort whatsoever. Okay. Okay, let me just sanitize those. So I don't know if the same is going to be on your right ear, but we'll have a look anyway and see what we can see in there. Okay. So I can't see any infections or anything like that. Everything in your ear canal nice and healthy, just like your left side. You do have a little bit of earwax in there, which I can remove for you, just like the other ear. Take 2 seconds again. Okay, sure. Sometimes people find that quite relaxing with these instruments, where they just go gently in the ear canal, and it's almost like a satisfying scratching, like when you get that sensation after a good old itch. And it's that sort of feeling. You just feel a little bit more open, airy and light in your ears. So, I mean, this is something else that I do here as well. Ear cleaning, I don't think you need it at the moment whatsoever, but maybe in the future, just to get it all clean and looked after and making it all nice and healthy. You can pop in anytime and I could clean it. Okay, so just going to apply that in your ear canal there. Right. Just a little bit further in there. Right there, do you feel that there? Okay. Just tease that out. Keep your head nice and still for me, you're doing great. Absolutely great. There we go. I'll be checking that. Everything is looking really good in there. I'm going to get that sanitized, so just a tiny little bit of earwax in there, but both your ear canals seem perfectly fine. Okay, but sometimes we can just get a little bit of earwax build up, and we neglect it now and again cleaning. Of course, it's not good to have cotton throbs and pushing earwax in as well, but eventually over time we need them just a little bit being cleaned, so to prevent the early stages of earwax build up, just remove those little bits there for you as well. So in regards to the cranial nerve examination we're going to be doing, this is just little tests, and because you've told me about you begin a little bit of headaches, and this could be a sort of eye straining or something like that, but I'm just going to ask you to do a couple of things for me, and if you can just follow them as best as you can. Like I said, it's not a test or anything like that, it's just determining how your body and what I can see in your features are responding. Okay, so first thing I'd like you to do for me is to follow this finger here. Okay, you think you can do that for me? I know you can. That's great. Okay, so you just keep following this finger here for me. Keep following it. Okay. Just keep following the finger for me. And keep following the finger. That's perfect. And the same again, you follow the finger here. Just keep following the tip of my finger. Okay, that's great. So now we're going to do a perception test. So if you can just look at my finger here, and I'm going to bring it in. You keep following it in. Okay. And then as it goes out, keep following it as it goes out. And in. Okay. And out. And zoom again. In. And out. And in. And out. Okay. Well done, that's very good. So I was just checking your eyes there and making sure your pupils are responding to distance. Great. Okay, so what I'm going to do now, are you familiar with this? Of course, all doctors have them. So I'm just going to shine the light in your eye. This might be mildly not so pleasant, shall we say, but it's not going to do anything to you. I'm just going to be checking your pupils, retina, your whole eye, basically, on both sides. If I instruct you to do something, if you just follow that movement, maybe just look at my finger so I can closely examine in there, okay? That's great. So if you just look at the tip of my finger, that's great. Just keep looking at the tip of my finger. Okay. That's great. And if we do the same again here, just look at the tip of my finger there. Perfect. Right. So just keep looking at the tip of my finger. Keep looking, just keep looking. The tip of my finger. Well done. Just keep looking there for me, that's perfect. Well done. So what I would like you to do for me now, I'm going to shine the torch again. If you just follow it around wherever it moves, let your eyes float around that and just almost trace the pen wherever it goes. Okay? So just keep tracing it for me. Follow the tip of the pen here. That's great. Well done. Just keep following the pen. You're doing a splendid job. Well done. Okay, keep following it for me. So you go from your left to your right. Just keep alternating nice and gently between the two. Okay? And just keep looking for me. Keep looking. You're doing a splendid job. Okay? And just keep looking there for me. Just keep looking. That's great. You're doing terrific. And just follow it a little bit longer. Just a little bit longer. Perfect. Well done. That's really good. So pop that back in there. Everything with your eyes so far upon quick examination seems perfectly fine. Okay, so I'm going to hold my fingers up here, and what I'd like you to do is when I wiggle a certain side, if you could just tell me which side I'm wiggling, that'd be great for me. Okay, so left side, well done. Well done. Well done. Well done. Well done. Okay. Well done. Okay. Okay. I always do a little trick one at the end. Just my bad sense of humour, I'm afraid. So well done. That was all perfectly fine. You're able to pick up every single one there. Okay, so I'm just going to do a similar sort of thing again. If you tell me how many fingers I'm holding, so what I'm going to do, I'm just going to ask you to close your eyes, so to stop you from cheating, I'll just put my hand there, okay. So, what I'll do, when we uncover them, if you can tell me how many fingers I'm holding up, and then I'll close them again, and I'll change the fingers, you can tell me again how many fingers I'm holding. Can you do that for me? Brilliant. Okay. 2, okay. 5, bottom. 2, okay. Bottom. Bottom. That's great. That's all perfectly fine. So you're familiar with this? What I'm going to be doing is just tapping the side. I'm just going to put it near your ears. And if you can tell me when you stop hearing the vibrations, okay? Okay. Well done. Well done. Okay. So similar thing again. I'm just going to tap this on different parts of your body. If you can tell me when you stop hearing the vibrations, okay? No? Well done. Just keep looking straight ahead. No, well done. Well done. Well done. Okay, just on your knees then. Excellent. That's great. Okay, so I'm going to be using the same instrument again. If you can just hold your hands out like that for me. Now turn them over. That's great. Back over. Back over. That's great. That's perfect. And I'm just going to ask you to hold your arm out there for me like that. I'm just going to tap different parts of your arm. Okay? That's great. So again, if you pop your arm back there, pass out your other arm, I'm going to be doing the same thing. Just tapping your arm down there, okay? That all feels fine? Perfect. That's great. Now the same sort of thing, but I'm just going to do it on your knee there. So if you can just extend your leg out a little bit for me, that's great. I'm just going to tap it a little bit. There we go. And just pop that back. And the same with the other one. Just clip it out there for me. There we go. That's great. You can pop that back for me. So what I'm going to do, ask you to do now, is just pull some facial expressions for me. I'd like you to smile as best you can. Smile, okay, and frown for me. That's great. Okay, if you just turn your head. Perfect. That's great. Now if you can blow air in your cheeks. Brilliant. And now if you could suck it in. That's perfect. Okay. So now I'm just going to come a little bit closer and I'm going to instruct you to do a couple of things. I'm going to be just touching your face and parts of your body and just go along with everything I'm saying there and try to do as best you can. Okay. So I'm going to push your eyebrows down. If you can just resist. That's great. Okay. So I'm just going to push your jaw. If you can resist. Okay. Now open. That's great. Now I'm just going to try and close your eyelids. If you can just keep them open for me. That's great. And now I'll try and close them. Brilliant. That's great. Now frown. Okay. Now smile. Same again. If your legs, if you just put your leg out there, you can resist. That's great. Very strong there. And the same again. You can resist. That's great. Okay, if you pop your arms out like that. Okay, no. Resist. Perfect. And same again. Perfect. That's really great. So just checking all your reactions and neurological responses. Just typing everything up here. So far, I can see absolutely nothing which is wrong with you. You've got a full bill of good health there that we can see from a cranial nerve perspective anyway. In regards to your headaches that you might be experiencing, it could be something just as trivial as staring at a screen a little bit too much than your eyes already are normally used to. And in this advancing technological age where everything is becoming screens and things, there's a few techniques that we can use to help combat this overusage on screens and what we're seeing all day in different light conditions. So if you find yourself that your eyes feel a little bit strained, or set yourself a target maybe every 30 minutes, just come off whatever screen you're looking at, try and find something long distance and stare at that for 30 seconds to a minute. This is stretching your eyes, and this is going to help when it comes to focusing. You're not going to have that straining with the light in the same tablet distance or screen that you're looking at all the time. This is really good for your eyes. If you're able to do this and you find that your headache subsides a little bit, then we know that it is to do with looking at screens and things like that. Of course, like I said, as we get a little bit older, eyes don't tend to be as good as they once were. Everything that I can see with your eyes so far look perfectly healthy, but this is something I can do on a further examination to get you a full-on eye test, which you can book here at the doctor's again. Okay, and your ears as well is something we can do as well, just on the side note. But in regards to headaches, if it isn't anything to do with your eyes, which I have reason to believe that I don't think it really would be, it could be a few little things like stress, sleeping, not getting enough sleep, or the quality of sleep isn't as good as it should be. And we've got ways here to help combat that, target the sleeping problem should you have one, and we can help utilize that to help these headaches of yours subside a little bit. Like everything we do here is here to help you feel brilliant all the time. Your health is my main concern, and what I want to do is make sure that you're always happy and you can come in, visit me whenever you want to get checked up, and I want to make sure that you're feeling great and you're content with everything, happy and feeling healthy and good. And that's not only just the physical things, this is also mental things as well. There's a lot of mental elements and aspects in health, and here we like to specialize in both aspects of it as well, because both are just as important as the other, and invariably sometimes can cross and be inevitably the cause of certain symptoms that we might be feeling. So there really is no cause for concern with anything. If you have anything in your mind, we can get to the bottom of it through just trial and keep testing and for various things. So your headaches, I think if you could do that little test for me, a little bit of exercises, and if your headaches subside, then we know it's to do with the screens. You can feel free to let me know that as well. If not, you can come back and we can get an eye test and check your eyes fully, but I don't think there's any cause for concern there with your eyes, because your eyes look to me to be in perfect health. But headaches, like I said, we can do a sleep therapy sort of session. We could talk about your sleep, how are you feeling, if you're stressed or anything like that. We can get that all looked for you here and make sure that you are feeling great all the time, because that's what I want for you. Okay? Well, I think that our session is pretty much over here. Okay, not that we're rushing you whatsoever. You could spend as long as you want here. Like I said, it's a comfortable place. There's no sort of time aspects here, but I'm just sure that you have things to do and you don't want to listen to me talking all the time. Maybe you might fall asleep or feel a little bit relaxed or something like that. Okay, so you opted for me to send your visit here today, email it to you, and all future updates I'll do through email, so when you next need to come in. But in the meantime, if you need to book to see me again, if you've got any concerns, like sleep for example, or something like that, by all means call up, we'll book you in and you'll come see me straight away, and I'll get everything set up for you to do a few tests. We can discuss things thoroughly to make you feel really assured and great and good, because that's what's important here. It's you. You're the most important person here. Okay? That's great. Well, it was so nice to meet you today. I'm really happy that you chose me to be your doctor. Dr. Fred. That's it. Well done. Okay, so of course, no one really wants to go to the doctor, so if I said I look forward to seeing you again soon, I mean it, but hopefully you would feel it as well, because here it's not anything to worry about. Like I said, we're here to help all the time. Brilliant. Well, really great to meet you. Okay, so feel free to go. Take care of yourself. Cheerio.